Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good afternoon, everyone. Thank you so much for joining us for our Facebook Live session with our topic today, Transforming Mental Health for All, Inspire and Inform Change. I'm Puan Anita, the president and founder of MIASA, and joining me today, we have with us Dr. Hazli Zakaria, the president of the Malaysian Psychiatric Association, who is obviously a clinical psychiatrist, and also Mr. Prashant, who is our assistant manager of operations and services and also a clinical psychologist. Dr. Hazli, apa khabar? Prash, how are you?
Good. Very good. How are you, Anita? Assalamualaikum warahmatullahi wabarakatuh to you. And good afternoon to Prasad. Good day. Yeah.
And how are you, Prash?
I'm doing okay. The end of another long day, but hopefully a good end to a long day with some good discussion about important topics. I was just thinking, for context for viewers, I also work for Dr. Hazli at his clinic in Shah Alam, but I was just thinking, I only ever see you, Dr. Hazli, at MIASA events. I hardly ever see you outside of that context, which is quite funny.
Okay, all right. Thank you so much. It's 5:30, and echoing what Prash just said, it's been a long day. To be honest, I'm extremely tired right now. But hopefully we'll end this with a good discussion today, inshallah. Okay, so we wanted to bring about this topic of transformation because what happened a couple of years ago, actually in 2019, we organized the International Mental Health Recovery Conference. I'm sure some of you joined us in 2019, and now with the pandemic, and now we're in post-pandemic or the endemic, a lot of things has changed. A small lethal virus has changed the way we live, the way we work, the way we do a lot of things today. And so I think this topic of transformation is really important, seeing how via this pandemic it has really highlighted a lot of things, right? Especially I think the lack of comprehensive mental health services in the community, as an example, the many gaps and the lack of focus from our side on the social determinants of mental health and also health. And we would like to talk more and provide a deeper focus on these areas so that prevention and also mental health promotion, early intervention can be put into place. So having said that, maybe I'll kick it off with asking Dr. Hazli the first question. Tapi mungkin sebelum tu Dr. Hazli, bahasa Melayu dan bahasa Inggeris kita campurlah hari ini, insyaAllah. Dr. Hazli, maybe what are some of the things that you are currently doing? What's new with you? Macam Prash cakap tadi, he also is working under Al-Amindah, tapi jarang jumpa Dr. Hazli. Jadi mungkin Dr. Hazli sekarang tengah bergiat buat apa tu? Kita nak tahu.
Okay. Thank you, Anita. Assalamualaikum warahmatullahi wabarakatuh. And good afternoon to Prasad. So thank you for the invitation. I think thanks to MIASA for your continuous effort in having this conversation about on mental health. How can we make the changes that is necessary for our country? So anything new, every day is a new thing, right? But the idea that made me kind of excited every time wake up so that I can continue make a small changes. I think if we want to wait for the big thing to happen, it's a bit difficult, right? But we start with the small, but the concerted effort from every single of us will make a big one. On my part, I'm in the process of get the Al-Amindah healthcare into the public eye by organizing the launching of that. but we are in the middle of having the second and third clinic, and going to have a few MOUs, including MOUs with MIASA also, that we're going to do it, because we want to start the movement in making the changes in the private sector, at least to
Yep.
start with, in terms of giving the clear landscape
Yep.
and the journey, so that they can start their journey in get back their health, their mental health, to optimize their mental health, and then where to start. I hope that I can do that in making the clear how, where, and then what are the experience is going to be like when they start the journey. But at the same time, you know, Anita, that we have to continue having the conversation about what can every one of us do to make the changes. We can complain, we can, you know, criticize, we can do many other things to motivate people to make the changes. But if we expect others to do, not us, not every one of us, and then the good thing is everyone else can contribute.
Betul.
But the problem is we just like to put the responsibility to others. So I hope I can do that, meaning that not just talking, we continue the conversation, continue the talk, but I want to prove that we can make the walk together.
Yep.
In order to make a changes. Alaminda Healthcare, through that, I hope all of us can see something can be done. I hope that can create or catalyst the belief we can do something.
Thank you. Thank you very much, Dr. Azri. I think it's an important point here, Dr. Azri. A few points here. The collaboration within amongst the public and private sector. I think this is so important. I think we're seeing more of this happening now because of the pandemic, obviously. And of course, when it comes to mental health, when we talk about transformation, it must be multi-sectoral. So hopefully we'll be able to see this more happening. Everyone definitely has a role in, accurately said by you, Dr. Hazi, that, you know, to do something big, it's obviously going to be challenging, but every person or every stakeholder can do something in, you know, a small contribution that can create a huge impact. It's like a puzzle that we all put together again, so everyone has a role to play in that sense. Thank you so much, Dr. Hazi. Tapi Dr. Hazi rasa lah.
Anita, tomorrow the CCAP from Putrajaya will come and do the inspection in the clinic in Cyberjaya. So I will keep
Hopefully
the finger crossed that
semua
everything's
lulus.
going to be okay.
Okay, inshallah, amin. Dr. Aziz, tapi when we talk about transformation, Nikan, what do you think are the areas that are much needed? I know you spoke about the public-private collaboration, but in terms of areas, which area do you think needs the most transformation at this moment when it comes to mental health?
Okay, I think the whole idea about making the transformations a reality, if we have the buying in from the top management, the policymaker, the bosses in the organization, the people in the C-suite, you know, the one in the director of the organization, because they can make the changes faster.
Betul.
But the people from the bottom need to continue the momentum, not giving them pressure, make sure that they start to see the reality. So the top down, the bottom up. But again, more important also, when we talk about mental health, we need to take the responsibility away from the Ministry of Health. Not saying that they did not have a role or they did not play their role well. They did well already with the limited resources that they have.
Yep.
But other parties, other ministry, other sectors need to play the role. If everybody can fly using the AirAsia, which now some of us cannot. But again, everyone should be able to contribute for the transformation by doing the small thing, at least by not doing the thing that we are doing now, which contribute to the stigma and the discrimination.
Yep.
Something that we can do now is by not doing something. So if people say, "Oh, I cannot do this, I cannot do," yeah, but the parents, for example, can do something else, can do a different thing. For example, Anita, the recent summit youth that are organized by the Yayasan Juwita, UKM, and a few other organizations, I mentioned was the scenario when the child, the teenagers who try to end their life, and then when discovered by their parents and then be rescued, being stopped from them committing that act, the first thing that usually came out from their parents, what were the words came from the parents? Why you did this? You are so, all these kind of remarks that make them feel bad for trying to do that, without the parents realize they have been thought about it for so long, but they just do that because they cannot hold on anymore. What they need, just the understanding. But the parents just silent, just hug them.
Yeah.
Do not say any other words, for example, because no words then actually can make them feel better. Silence may be the words that they want to listen. By the touching, the hugging, make them feel the parents understand their suffering.
Definitely.
So that's the example. How can we do that? If we increase our knowledge, improve our mental health literacy, be involved in activities that we can understand better. So that's what we could, and then not doing what we're doing now, which enhance the stigma further, and then make them feel not really being understood.
Yep. Thank you very much, Dr. Z. Not everything needs to be expressed verbally, right? Just feeling it is also a definition of empathy. Thank you so much, Dr. Z. And also the other thing is probably, being the Ministry of Health, their role could be facilitating the multi-sectoral collaboration and also coordination, because somebody needs to do that, right? So I feel that maybe for a multi-sectoral collaboration, MOH could play, or the health sector could play that role. Thank you so much, Dr. Z. Okay, Prash, moving on to you. Prash, for those that are not familiar with the mental health scene in Malaysia and are listening, and maybe you can describe, what is the scenario like in Malaysia currently? What are we looking, Prash, in terms of gaps, challenges and investments at the moment? We all know Malaysia only invests about 1+% in mental health, where a bulk of the money goes to the 4 big psychiatric hospitals. And, a majority of people in the community are underserved. They're not being treated. We lack, comprehensive mental health services, community-based support, etc., etc. So what are we looking at, Prash, at the moment?
Right. Thanks so much, Puan, for having me on, firstly. Many thanks to Dr. Hazli also for joining us, for accepting our invitation. So, sure, I think there's a lot we could talk about when we're trying to describe the mental health landscape in Malaysia. It's probably a convenient time for us to be doing so, because we just did a research project, right, asking about these very things. I probably won't rehash some of the stats in terms of, what we've seen in terms of the rise in, mental health, people struggling with mental health disorders, or the rise in cases of completed or attempted suicide over the past few years in the wake of the pandemic. We all know, I think by now, that there has certainly been an uptick in all of those stats in the past couple of years. In terms of the service delivery, because I guess obviously at Miasa we're an advocacy organization and we focus a lot on raising awareness, which is what this kind of talk is for. But we're also involved in service delivery, right? Which I guess Alaminda is also, service delivery. What we understand about service delivery in Malaysia is that by and large, we can say it's still more clinical in nature. And when we say clinical, services tend to be concentrated for a vast majority of the population within, the government sector. So I think I was reading about some stats where, YBKJ in an address in December said that we have about 459 psychiatrists in the country, and ideally we would need about 260 more within the next 4 years, and maybe as much as 500 more by 2030, which is quite a remarkable stat, actually, when you think about it. So the practice of psychiatry or mental health service delivery has probably been around for what, I don't know, Dr. Hazli could correct me, maybe close to 100 years, maybe, depending on, how far back we're going to go in some form or fashion. Yet the stats project that in order to meet the demand, we need to double the amount of psychiatrists that we have in the country by the year 2030 in order to cater to the country's projected population. Even then, I think the ratio would be something like one physician or clinician for every 30,000 to 50,000 citizens, which is a lot, right? I mean, if you think about it like that, it's quite a lot. And so there's certainly a huge need to increase our scope of the services available. As we know currently, a lot of people may be stuck with long waiting times. Timely care can be either inaccessible or very cost prohibitive for a vast majority of the population.
Yep.
And it's also, what we understand is it tends to be concentrated in cities, right? Big cities like Kuala Lumpur, we have a higher ratio of clinicians available compared to, say, 100,000 people in the population, whereas the more rural areas, particularly states of Sabah and Kedah, I was reading, have a much lower ratio of clinicians available to the population. So that's just in terms of clinical services itself, right? If by and large, I think we all view mental health care through that lens, still, or at least a lot of people do, purely through the clinical lens. And if through just the clinical services itself, we're already seeing some of these shortages, whether it's in the government or elsewhere. And then that's even before we come to the idea of community-based services, non-clinical services, which leverage on all these other things that impact people's lives, whether it's the spiritual side of things, the arts. And also, I think at Miasa, I'm sure Puan Anita, you'll be able to explain in a lot greater depth this idea of peer-run alternatives, and this idea of reaching out for support to people who have been in a similar situation, which I gather in traditional clinical settings may be quite lacking. And that's something I think we at Miasa try to advocate for and promote. And because they work, right? I mean, just in terms of our anecdotal experience over the years, there's a real demand. If the research that we did recently indicated anything, there's a real demand among people who have lived the experience with mental health challenges for these other alternatives rather than a strictly clinical view or a clinical model of recovery. And so, I mean, it's a catch-22 situation in that, we seem to see that these things work, but then, they say, we were just discussing this recently, right, in terms of, there's no evidence base, but then in order to get the evidence, you need to be able to fund the research. And then as an NGO, you never have enough money.
Yep.
So it's not something that we talk about enough. But yeah, I mean, this is kind of a quick snapshot of where we are at in terms of the mental health landscape, what's on offer, what could be offered more, etc., etc. And I guess one of the silver linings, perhaps, if we can call it that, over the past couple of years is that this is being talked about a little bit more now compared to maybe what it would have been before. We are paying more attention to mental health issues, how we can best support wider society when it comes to emotional well-being and so forth. So if there's any silver lining to be taken from the past 2 years, perhaps that is one of them. Perhaps we're talking about this more, we're more willing to do this kind of thing more. and now it's just a question of building upon that moving forward.
Yep.
Yeah.
All right. Thank you. Thank you so much, Prash. I think one of the most recent articles that just came out from WHO really highlighted upon developing, strengthening, and also expanding community mental health services and support. So this is really where we are currently lacking, kan Prash and Dr. Aziz, sebab kalau tak, what happens is, why do people fall through the gaps, right? It's because the community rejects them. What does this mean? This means that you don't have a sustainable model in the community where people can actually work and live and enjoy, quality life and return to normal functioning. Because even if they do go through that recovery process, there's nothing in the community for them, or lack of a lot of things in the community for them. And Prash, Dr. Aziz, in the work that MIASA does, and what we've seen is this is exactly and entirely true to the experience of the peers on the ground, where they've gone through that recovery process. Job opportunities aren't available in that sense, where it's not supporting their recovery process, hence they're not able to sustain it, and then they lose the job. So without that livelihood, and then they can't maintain a house, or even rent a room in that sense, and then they end up homeless on the streets, and then reoccurrence of episodes happen, or relapses happen, and then they end up incarcerated in prison, or end up institutionalized, and then it reinforces stigma, and then people say, "Wanita kan betul, orang ada penyakit mental bukan boleh kerja pun, tak boleh sembuh pun." So this is why having or strengthening and developing these things in the community is so important. And this is so in line with the push that WHO has instilled since 2013 via their action plan, 2013 to 2030, right? So it's a 17 years plan, and hopefully with this pandemic hit that has happened, that we are able to aggressively move towards this. So Dr. Hazi, having said that, we know that the negative impacts brought forth by this pandemic, this was built in years ago. It wasn't because of the pandemic, but the pandemic definitely is a stimulus to everything that has happened. In your view, or in your opinion, Dr. Hazi, what is the role of the health sector, right? How can the health sector help in terms of strengthening community-based support is one, but for people to access quality services, safe services, responsive services, effective services, what is the health sector? What can they do, Dr. Hazi?
Okay, this is a very good question. Again, is okay. What the healthcare sectors need to transform themselves to be more hospitality, has a better. I mean, we have hospital without hospitality. We have a clinic without the hospitality. So, what I'm trying to say is, like, we have to be secure enough for others to give input, for us to be rated in terms of the quality of services that we provide, and then use that as a way for us to improve.
Yeah.
Let the service user give us the feedback, so for us to improve. But having said that, the healthcare is not just focused on the treatment. I know the limited resources budget, as mentioned by Anita, made us focus on the treatment.
Yep.
But we know they end up, the people who do not reach to the level need the treatment, the one that need to be prevented, they are left without any assistance. No one who provide that kind of support to them. And as mentioned also, the recovery. Unfortunately, we increase the number of clinical service providers, but there's other sectors that are also important are being neglected. or being left out without a proper training for them to provide the support. And so that is important. We know that sometimes we are excited and then highly motivated to make a change, but without the knowledge and the proper guidance, proper training, that sometimes will end up make more damage than the benefit. So that is where the evidence base is really help us to decide what kind of strategies, what kind of service that, or what kind of assistance is needed. So unfortunately, right now when we are talking about the service provider, people still go into the treatment. It's like everyone try to do the thing that everybody doing it as well. You know, just like we go to the pasar malam and then jual benda yang sama saja. Yon taufu, yon taufu, yon taufu. Nasi lemak, nasi lemak, nasi lemak. The difference is only in terms of the cover. In terms of some nasi lemak, ada udang, ada telur. And so that's the whole idea. We not able to open the horizon in terms of let other people do that. The task shifting, which are recommended by the WHO, also need to be practiced. And then we are lacking in terms of the coordination. We have the people who can provide the services, but the coordination in and up that the place that they go very overdose with support, and other area they are very being neglected. So again, they need to be a kind of like a body who can oversee this rather than, you know, focus on the same thing over and over again. But the input from the health is not just as the service provider per se, but they can also play the role behind the scene and then helping for the services to the community. Again, how can we make it materialize? Because all of these need resources, need fund, need money. We cannot run away by talking about the important part of that. And again, the sustainability, Anita. Most of us are very good in building something new, but after that, maintenance is never being planned properly. We very good in come up with a module. Then after that, the executions is only for 1 year, and then the budget run out, and then we did not continue. So the whole idea, we need to have it. But the problem with us, Anita, for me, it comes back to the honesty, the genuine. Who going to do this? Don't worry so much in terms of who's going to get the credit, but rather focus on who's going to get the benefit, the patients and the family. But we are so territorial in that area. And then we, in fact, we every time there is a change of the, again, the leadership, there's going to be a change in the policy, the change in the project. Even if they cannot do anything, change the name of the project so that they can look like a new one. And then last one, whatever we do is either come from the health sectors or whatever other sectors, we really need to measure the impact of what we are doing, what we try to do. And then the measure of the impact, not necessarily just on the service user, the end result of that. The process for us to do that, it can be documented so that other people who want to do similar intervention or strategies would not repeat the same mistake. Some of us, Anita, so malu, don't want to document our flaws, our mistake that we did, our error, because we want to keep the reputation. Please, that is something that we really need to be clear. We have to share the success and also the lesson that others can learn. If we have clear about this, this is what the important ingredients for the transformation.
Thank you very much, Dr. Aziz. A couple of important points that you just highlighted. First and foremost is humanizing mental health services. I think this is very much what many of our peers experience. Two, we want to talk about task shifting. And I think this is also, one of the things that's being recommended, suggested over and over again by WHO, really task shifting to the non-health sectors, right? Individuals, volunteers, people with lived experience, first responders in the community, because at the end of the day, not everyone needs, intensive clinical intervention. When we look at crisis support, like Miasa is an example, the majority of us are people with lived experience. We're not, doctors or at minimum, not even counselors. But because of the experience that we've gone through, we are able to provide, that place of coming from that place of empathy and compassion, and being able to relate to that situation in the sense that, we've gone through some of the challenges that these people have gone through. So being safe in our communication, and at the same time having empathy and validating what the person is going through or experiencing, which is truly helpful in that sense when a person is in crisis. And of course, Dr. Hazi, again, like you said, maybe we don't have the money necessarily at the moment, but redistribution of resources, I believe this could work as well. Things that we're doing currently that are not working, it's not moving, that the impact, let's move it. That's also the other thing that, we can do that fast actually. And making it sustainable. And also, Dr. Hazi, like you said, documenting things so that we can all, share these lessons, share things that work, and learn from it. Whatever that works, we can adopt. Whatever that doesn't work, we can, not do it in that sense, right? So we shorten that learning process as a whole.
Anita, sometimes I'm not sure whether it's a Malaysian culture or Asian culture. We kind of like, sometimes when we see, we observe the organizations who did well, who managed to come up with projects with limited resources, and people start to, feel intimidated by their presence. So Miasa is a good example of that. It's a new, and then people say, "Oh, is it as it's a Macau scam or whatever? How they managed to get the fund or whatever?" But they didn't realize. I'm pretty sure how hard all your volunteers and you and yourself we got come up with a project. But again, this is the attitude or something that we really need to delete from the way we when we being intermediated by other people who want to make a change. If you cannot support them, please don't make them feel demotivated by all the things that make them feel their effort is not worth. That is something I think that we really need to be aware about this kind of attitude and belief, which I think not good. But these people who have this or this organization who have this, they really need to check their mental health because something is not right there.
Thank you very much, Dr. Hazi. Indeed, doing this work is hard work. Truly hard work, blood, sweat, and tears. Some days are very, very difficult. I invite you to join us, those of you that are listening in. If you want to make a change, if you want to see, and be involved in the work that Miasa does, or any of our friends on the ground, please do come. Because obviously, as Dr. Hazi mentioned, we need as much help as possible. We're not financially independent. There's a lot of work. A lot of people are struggling on the ground. Just to give you a little bit of insights for those of you that are watching and listening in, from January 1st until May 30th, 2022 this year, we're looking about 20,000+ people reaching out for help via Miasa. This is Miasa alone. So imagine our other friends in the community that are overstretched at the moment. So we definitely need as much help as possible, and we welcome the private sectors, if, you guys want to help us out. We would like to give maybe a shout out really quickly to Yayasan Samdabi for, supporting Miasa with our crisis helpline. This is one of the reasons why we're able to continuously expand our team, train our team, and also maintain our 24/7 crisis helpline. So thank you so much. Okay, Prash, going back to you, Prash, yeah? Okay. Prash, you've been with Miasa now for quite a while. Not just Miasa, any organizations, on the ground, doing advocacy work, helping people in the community. I know you were a volunteer for Befrienders before as well, but you're also a clinical psychologist. So coming from that clinical side, right, looking at the clinical aspect of things, and then coming in, joining a, not just a mental health NGO, but a peer support group, right?
Yeah.
Majority of us who would
One of
live
the
in
few, yeah.
Yeah, one of the very few, and the first one in Malaysia as well. It would be really interesting, Prash, to hear maybe some of your experiences and thoughts. What surprised you maybe, when seeing it from a different lens maybe. Now that you're in Miasa, Prash, how has that been like?
Sure. It's been quite a revelation, truthfully. Yeah, I think when I first joined, just realizing, it's just expanding the scope of what I thought was possible when it comes to supporting people in their recovery. I think by and large, when we are trained as clinicians, certainly we tend to kind of see our role exclusively through that lens. And so if someone is struggling emotionally with their mental health, then that's the first port of call, right? Is to reach out to a psychiatrist or counselor, or one of those kind of traditional roles. And I think as clinicians, perhaps the danger of slipping completely into that kind of mindset is, and we see this right in our own dealings with all the many peers who have come through our door in one way or another. In the extreme cases, it is taken to the extent that I'm the expert. I'm the expert, and it comes at the expense of respecting the peers' right to decide for themselves, thus implying that in a way that person is helpless, and they do not have the ability to think for themselves. And this is kind of reflected in the practice in a lot of settings across the country generally, right? It's what I think generations of clinicians have kind of been taught in some way or another. Certainly, there are many who practice something slightly different. I'm not saying that, of course, a lot of them take this mindset to the extreme, but we've heard it enough times, more than enough times now to know that it's not a one-off either. What is coercion if not that the clinician knows best, regardless of the person's wishes? Informed consent is practiced insofar as it is convenient to do so, but when the going gets a bit tougher, suddenly the imperative towards informed consent may be not as strong. Although, to be fair, in my own experience, even when I was training, I've never necessarily felt like that has been the case, that kind of extreme mindset. In my own training, the settings I've been fortunate to be a part of, including in the government as well, at HUKM and several others, by and large, from what I could see anyway, there seemed to be this good faith effort towards, trying to, practice informed consent and have, the peer be part of the decision-making process. But that's just my experience. But certainly in community settings, having been part of Miasa for a while now, this is more the case at Miasa, because at Befrienders I was more just as a volunteer. I was not involved in any of the advocacy work they may have partaked in. I think just this idea of having models of care which are more holistic and a bit more reflective of the scope of the problem, let's face it, moving away from models that are exclusively focused on symptom reduction. Not something we think to do at first. It's just not the way we've been trained. But when you think about it and it's raised, you're like, yeah, why didn't we think of it? And it makes complete sense, rather than simply trying to identify what's wrong and removing it, and instead focusing on a peer's strengths and identifying what they want and help create, identifying what they want and creating it, as opposed to finding what's wrong and removing it. It seems like the same thing, but it's actually not anything. And I think this is where Miasa and community-based mental health probably differs and can take it a step further than a lot of traditional clinical settings, because mental health disorder or not, I think by and large, all of us, we want the same things, which is, it ultimately boils down to just building meaningful, happy lives as far as possible for ourselves. And at Miasa, we try to emphasize this. So beyond just clinical stuff, focusing on what other supports can be put into place to, help people get themselves on their feet and supporting themselves right in the community. And so I think that's one of the main things that struck me going from,
Prash,
clinical to community. Yeah.
somehow I'm not able to see you anymore.
Oh, really?
So you are transforming. To
Transforming.
Oh, it's the sun.
It's a sun. Yeah, I think maybe
Yeah.
maybe you need to remove your background at this point.
Okay.
But anyway, while you're doing that, if those of you that are tuning in, if you have any questions, feel free to put it in our comment section, and I will maybe hopefully ask our panelists. Yeah, Prash, I can see you now. Yep. Okay, great. Yeah, it was like you had light upon you.
Yeah, it's probably
Yeah.
not in a helpful way. Yeah.
Okay, go ahead. Yep.
Yeah, but I think that was basically I think what struck me about now having been part of a community-based organization for a while now is just this idea of not having, basically what it boils down to is just not defining people strictly by their symptoms, and understanding that, and this is just not an opportunity we have in traditional clinical setting, is getting to know peers outside of their symptoms, essentially,
Yes,
which is where we have a lot more opportunity to do so, whether it's I've learned a lot more just interacting with staff and our other volunteers and so forth, and it really comes into sharp focus how there's just so much to a person, right? And whether they're
their
struggling,
condition, right?
yeah, then there's so much more to a person than just their condition. And this is hopefully where Miasa can really make the biggest impact, is hopefully having people struggling with mental health challenges realize this themselves, that there's far more to them than just their struggle. And it's also, I think, another aspect which I find probably brings added value is just helping people find a sense of community. I think when people struggle with mental health challenges, they can often feel quite lost, right? And lost and alone, and don't know where to grab onto to just find that bit of support. And hopefully what we offer here is that sense of community, that sense of belonging, which may have been lacking elsewhere. Because as we know, through all the research done on a lot of mental health, one of the things across any kind of mental health disorder which can be indicative or predictive of someone's recovery is just the amount of social support they receive. So this is again somewhere where I think Miasa has kind of opened my mind up in terms of what is possible and what we ought to be doing, to really support a person's recovery beyond just getting rid of their symptoms only. Yeah.
Thank you very much, Prash. Exactly what you just said. This is actually what the recovery model talks about. That we are, or the individual is beyond their symptoms, right? And I'm so glad you touched on a lot of points about how at Miasa we have that luxury in that sense where we can interact with the person and understand more, because we are able to see them in a different kind of settings, right?
And it's a shame that it's a luxury that we have to describe it as
exactly, right? That when you come into the clinical setting, it's already about the treatment, and hence why we need more community-based settings like Miasa, where people can come in, they can socialize, they can network, interact, and find their tribe in that sense, right?
They can become involved in the work themselves.
Exactly, and make themselves useful. And then that way it's what we call it dulu kan Dr. Hazi, masa kita buat journey to recovery dulu, is helping, healing through helping, which is obviously one of the big things that we initially focused on being Miasa. So thank you so much, Prash, for that. Okay, Dr. Hazi, silakan.
Want to mention also about that for Alaminda per se, right? Because not just Alaminda, for any other organization, any other company, for example, we need to have the Ministry of Health. I want to provide the services that Ministry of Health not be able to do at this moment because of their limitation in terms of the budget and the resources, but focus on the prevention. For example, Anita, provide the services to the children's after their parents went through divorce, and then it kind of like the kind of the support by the counselor who are being trained for the to deal with children who normally we wait until the kids show the side effect of the divorce when their results has deteriorated, or they start to show the externalizing behavior, and then we refer, and then at that time we already lost the chance to do the prevention. Meaning that most of them will be supported, will allow them to ventilate, allow them to share, and then of course the services need to get paid for the services again at that affordable with the certain standard of I think that is some kind of element of prevention that we need to encourage. Don't wait until the things get worse and then require a more intensive intervention. So the whole idea, that's what the MIASA focusing also. We want to see them, to engage them before they start to show the symptoms that require the clinical services that we are lacking at this moment. So that's the whole idea that we need to look into. That make the transformations much easier, and then it more practical to do rather than just providing the services that has been provided by other sector, for example. So that the whole idea, when we have a better coordination, and how can we work together to fulfill all the unmet needs, then we need to prioritize also which unmet needs that we want to do first.
Yep, I agree. Thank you very much, Dr. Hazi, for sharing that. Dr. Hazi, also one of the things that we're looking at is, of course, the workforce, kan? Sebab kadang-kadang, especially masa pandemic hari tu, health workers, especially we were prioritizing COVID-19, obviously, and they were, exhausted, tired in that sense. Jadi bila kita nak membuat keputusan menjadi serabut lah kan Dr. Hazli, we tend to take more shortcuts maybe. Mungkin kita sebenarnya a person that has a lot of empathy, but then now that kita dah penat hari-hari benda yang sama, kita pun dah tak, orang kata, empathetic lagi contohnya kan. Obviously we're all human beings in that sense. So what is your opinion in this area? How do we improve our mental health care? Tadi Dr. Hazi dah kata humanizing it. We also spoke about investment. Tetapi without the orang kata healthcare workers, without the mental health workforce, sudah tentu kita tak dapat menjalankan semua benda-benda yang kita cakap ni.
Okay.
The community is a different part of it. Tetapi the healthcare per se, in that sense, what needs to
I give the example, the strategies or the innovation that has been done in the workplace by organization. Tomorrow, I'm going to visit another psychiatrist. We are going to observe the trainer that we have trained in Petronas for them to conduct the mental health in the workplace, which the module developed by Petronas themselves. Can you imagine? They went to learn from UK and then they brought back and then they localized the module and then they call it Mind a Gap. And then they managed to give the responsibility to train all Petronas employee to the INSTEC, the institute in the Petronas, so that there is going to be the ongoing continuous training of mental health among the Petronas employee. So from the top, from the bottom, so they make it kind of like that's going to like after a certain period of time, most of Petronas employee will have a understanding on mental health, at least the basic understanding of mental health, in order for them to be able to look after their mental health and be able to help others, their colleague, who they are able to detect and then lead these people to the services that are available in Petronas, the EAP, Employee Assistance Program in Petronas, went to other, like they have a lot of program, but no one know in terms of how to get access to the program because the difficulties of that. But the fact that they have this initiative and then they work with MPA, Malaysian Psychiatric Association, as the trainer, so that make sure that the validity, the credibility of what they come up with, the training is fulfill certain standard. This is the first in the country. The organization, the oil and gas, they have their own, basically the first, they have their mental health first aid module, that they want to increase the mental health literacy among the employee. And then now, but I'm quite surprised they did not promote it. So to get the news, spread the news, because they don't really need the credit. They don't want to get all the they don't really need the to establish the brand or the marketing part, right, Anita? I'm pretty sure if other organization, that when they do that, they will be in the front page of all the newspapers in the country. But the whole idea, some people, they really do the work, not just talk. But for me, we really need to learn to support this kind of people. I'm pretty sure other JLC also started to show interest and then come up with more and more innovative project to help with their employees. Previously, Anita, I always been invited to give one talk to a mentor about stress in their workplace. After that, no more activities for the rest of the year. And it's not sustainable. They do not do anything. All what they did last time also, screen. They did the dust. After that, nothing happened also. People who have the score with dust being asked to do whatever you do lah, whatever you have to you need to do. There is no continuity. But now a few other organizations, they started to have A to Z in terms of the planning. These are the organizations that we need to share. I mean, they are, whatever they did, we need to share, and then need to be highlighted. Hopefully, that other will get be inspired. That it show that it can be done. This is the concept how the Malaysia boleh. We need to know it's not boleh in other thing that we don't want to talk about. So the whole idea is a lot of other activities like this, Anita, is happening. But again, we they are too nice. They are too to keep it so quiet. I don't know why. Tomorrow I will tell Petronas, make it a news.
Okay. Thank you, Dr. Aziz, for sharing that. But that's more of the workplace, kan, Dr. Aziz. What about the psychiatric fraternity?
Oh, psychiatric fraternity, we are good already. Why you need us to change?
Oh, no need to change.
Okay. Now, yeah, I think that the whole idea, when I said just now, we need to be able to come to the stage that we should be open enough to listen to the feedback, in fact, to be criticized. Because again, otherwise we just maintain the status quo. And when I said this, I know that someone will record it and then send to other psychiatrists, and after that they will hate me even more. But do I care? I do care, but I don't I don't want to focus on that. The whole idea yes, we have to work together.
Yep.
We have to work with
I agree.
other service provider. We have to work with the family for the pay, with the clients, with the peers, with the whatever the term that one. And we need to work with people who want to help. That's something that we sometimes we do not emphasize. But unfortunately, Anita, I have to you know that you've been in this this field for quite some times. You know that some people, they show that like they really want to help, but they do not really want to help, but helping themselves. Unfortunately, these people will demotivate people who really want to make a change. And but of course, uh, it's okay if you want to make a change and then you want to gain something out of that, but don't get too much lah. So the concept of balance again that we need to do, because we have to be win-win situation.
Yep.
That is need to be clear, because we cannot just expect to do something and then without really look what are the reward for us to do. Even Miasa, remember, I keep remind you, don't be too nice. You have to charge a certain charge a little bit more. If they know, when they go through you and then through Miasa, what I'm trying to say, they can get a cheaper fees. No, we have to put the value where we are. That's what important also. Psychiatric fraternity, they need to recognize, to know their value. But at the same time, they need also to work together, because sometimes because they still do not put the certain fees what they are supposed to get, because they think that they want to have, no. We have to be clear in terms of what we want to do, what we can contribute, so that people do not take advantage of that. But at the same time, there are certain things we have to be flexible enough for us to work together, and then do not care so much in terms of what the reward that we want to have. And then psychiatrist is not just a clinician. We need to be a advocate. We need to be involved in the promotion. We need to involve in the policy. We need to work with human rights. We need to work with the GLC, the employer, and then we have to work with our enemy who doesn't like us also. That's the whole idea, because that what we need to change, not just a clinicians. Otherwise, we do not make a transformation.
All right. Thank you very much, Dr. Hazli. I think the end game is to achieve it. We must work together. No more or no longer working in silos. Obviously, again, working in silos, we can achieve things, but if we work together, we can create miracles. We can make a transformation.
Anita, the good news here, KKM, Ministry of Health, is going to work with MPA for MPA to be the secretariat for the parallel pathway for the training for the to be a psychiatrist. So that is a good news. So that hope, but unfortunately, I'm no longer the president by that time. But again, we make sure that the new breed of psychiatrists that will be able to see, as how Prasad said just now, we should not just focusing on the symptoms, on the on the treatment. We need to go beyond that. So that's the whole idea.
Yep. Thank you very much, Dr. Asi. I think that was very insightful. Again, coming from that mindset where there is a possibility that we don't know everything, and also there is a possibility that there are better ways to do things. So thank you so much, Dr. Azli. Okay, 6:34, guys. We only have about 10, 11 minutes left. Baru round three pun tak habis lagi, Dr. Azli. But anyway, going to you, Prash. As we know, Prash, in the work that we do, in the advocacy work that we do, having people with lived experience is crucial in identifying the disconnect between what is being offered to what is needed, both on an individual level in the community, etc. What are your thoughts on this, and what are we looking at, Prash, at the moment?
Yeah, I mean, this, the whole conversation about having, peer be a part of, decision-making processes and having a say in how things are done is so crucial. Just talking about something like this with a client recently, actually, although it was in different context. So it was more within academia. So in academia, obviously you have research, you publish journal articles and so forth. And he was quite involved in academia. And I also previously, was involved in research for 4 or 5 years. And he was talking about, gosh, when I read journal articles, even as someone in academia, sometimes it's so verbose, it's so technical, it's like its own language. And yet the goal of publishing this is so that the wider community is able to understand it. But then, if we as academics struggling to like comprehend a lot of the things being published in journal articles, then then what are we doing here? And he ended it by saying something like, if I only wish the average reader, the lay reader, could have a say in how the language that is used to publish these journal articles, which I thought was quite a neat analogy in terms of what we mean when we're trying to say have the peer be involved in the decision-making process, right? Because at times, when it's purely clinicians who decide, what the practice guidelines are and so forth, not to say it can't be beneficial, because obviously things as they are have been very beneficial to a lot of people, and clinical input and expertise is very much needed. But also having it come at the expense of, as Dr. Hazli was saying, the service user. Can you imagine, if you're in any other line of retail, for example, you're building a brand, you're doing all these things, but you don't get the input from the customer. It doesn't sound like a recipe for, a
success,
brand,
right?
for a success, exactly.
Yeah.
And so surely that ought to be reflected even in, and if not even more so in, in healthcare practice and mental health, where quite literally lives could be on the line, and there are a lot of strong emotions involved for some of the things that people go through, either in physical or mental health.
Yep.
So it's certainly a very, very crucial conversation for us to have, and it seems to make sense on a intuitive level, but yet, I guess and you'll be able to speak a lot to this point, and it runs into some resistance when it comes to trying to put things into practice. And I guess it's linked to, this ingrained culture of how things have been done, and thus how things ought to be done based on, our past history and so forth. And I guess the key is, how do we get, everyone involved to understand that it's not a question, as Dr. Hazli was saying, of, trying to give someone a bad name or running someone's name through the mud, but it's just more about, how are things going to improve if we do not really, take a second to really reflect and take a good look at how things are being done and where the gaps still are and what could be improved. It's more a question, having that humility to be able to say, we really ought to get the input of the service users, who in this case are people struggling with their mental health, to see what works best, what could be done to improve things, because it's not pie in the sky stuff, right? Like we have examples from elsewhere of how things can be done and how things could be better if they are done, in that way. And so it's just a question, I guess, continuously of trying to, put forth that case and have people feel like you all have a part to play in this process of, including and especially peers themselves. And it's not a question of, us against them kind of thing. Understanding we all have to come together. Yeah.
And having said that, right, Prash, that's a really important point to note. So Dr. Hazli, just want to ask you really quickly kan, sebab yelah Dr. Hazli pun dah jadi psychiatrist dah lama dah. Why do you think this continues to happen? Ataupun kenapa these improvements are hard to make? Is it stigma? Is it perception? Kenapa sebenarnya Dr. Hazli? You are muted.
Okay. I think it's a very difficult question to, because everyone want to improve, right? Everyone want to make a change, but sometimes it's a very tricky. It's not as easy as it sounds. For example, Anita, we are talking about the number of patients that we need to serve in the public services, right? And then the number, the lack of service providers, the lack of space, the lack of clinic, the lack of room for the doctors, for the psychiatrists to see the client, the patient who come. We are talking about, yeah, that's why I said sometimes we were talking about big things, you know. For example, there's one of the discussion about the public and private partnership, right? There is a I would say one person asking, what happened, yeah, if this patient, they move from the public to private or private, and then they're going to have a different change the service providers. And
Betul.
I'm asking this person, do you aware or not that when they went to see help in the public services, not all the time they will see the psychiatrist, they see the MO, and then they keep changing from one MO to one medical officer to another. They keep changing from one clinical psychologist to clinical psychologist. And then not just about that. Can you imagine, yeah, Anita and Prasad, they sometimes, not sometimes, most of the time, they need to share rooms. And then two patients need to be in the same room, attended by two different doctors to talk about their issues, which most of the time are very private. That one also we having to face this day every day. Then when we said no, only one doctor and one client, but we have like 120 patients that waiting to be seen. So when then they need to, the appointment that will be long. And then instead of need to be seen every 3 weeks, 4 weeks, they need to be seen like a 6 week or 2 months. It's not like a patient with orthopedic problem that a broken leg that can be seen after 6 or 4 months, for example. So when we are talking about want to do change, yes, but at the same time, we have to be realistic. But we need to change this. We ought to let the patient share. And then we need to come up with solution. How that? We need to talk to all the GLC, all these billionaire top 20, do something. So, and then that is what I said, that we need to be realistic. We need to do something that's feasible. We beside the conversation, with the talk, what we can do now, for example. I'm thinking if I have a lot of money, Anita, I will have the trailer, whatever, you know, the container, I will do that, put the aircon and make it nice. And then if we can have food truck, why can't we have a truck, make it a room for the consultation, for example, and then move to another clinic the next day, for example.
But this is what it's all about. But
I don't
this
have
is
the
what
money
it's
yet, but I will make that happen when we have the money.
Yep. But this is why we need to consistently talk about this kind of
Having said that, Anita, having said that, right? If we have the money also, we want to talk to the pengarah hospital. Say, no, cannot. Nanti malu, orang lain tahu yang we don't have ni. Keep quiet, Don't let anyone know that they need to see more than one patient in one room. Keep quiet. That's what happened.
But that's the thing.
When we start, no, you ask the question that can trigger me to show my true emotion. That's the problem.
Because you're a human being.
No, because that is something. That's what I think. That's what we need to do, Anita. I cannot imagine myself talking about something that I don't want people to know, and then someone else besides my therapist, besides the people who want to help me, able to listen to.
Thank you very much, Dr. Hazi. I think it's really important, because if we don't continue this conversation, I know, you always say with, discussions, with talking about it, there must be actions and, follow-throughs, which we are indeed doing. Tapi kalau kita tak bercakap pun, orang tak tahu bahawa, this money is much, and, it must be invested in. Jadi hopefully, because the pandemic has happened, and with the data, with research supporting it, that we understand we must invest in mental health, and we need to move aggressively. It's urgent, because if not, we are going to continue losing people to the condition where they're not able to recover well and effectively People are not going to be able to be productive in workplaces. As an example, children continue to battle mental health issues without being helped and supported and treated early. So banyak benda perlu berlaku ya Dr. Aziz, and only through having these funding and investments can we strengthen all of this, especially human resources. And of course, this is actually a big push juga Dr. Azli for task shifting to happen in the community. Kalau benda ni boleh berlaku pun, kita dapat membantu ramai orang. A lot of people don't have to fall into having depression, anxiety disorder, being suicidal, etc., etc. Kalaulah people in the community can become, a resource with a little bit of training, kan? Jadi ini yang kita harapkan, crisis support being strengthened in the community as a whole. So I know we don't have much time. So maybe Prash, to you, just to wrap it up, Prash, maybe some last words on your side on our topic today of transformation, transforming mental health for all, and of course the World Mental Health Day theme this year is about prioritizing mental health, where it should be a global priority for everyone. Maybe some last words from you, Prash.
Yeah, I think we've already covered so much ground. I'm not really sure where to end, but I guess for those listening and watching in, most important thing to understand, and I guess one of the things we really highlight in some of the work we've been doing, I think Dr. Hazli also has been mentioning, is that everybody has a role to play. The scope of the response ought to match the scope of the problem, because as we know, mental health is not only mental health. If you're from a lower income group, for example, you're anywhere from 2 to 4 to 5 times more likely to be diagnosed with a mental health disorder at some point in your life, depending on which study you're quoting. And so it's important to know that everybody has a role to play, and that there's in some way a lot of things that may not be obviously related to mental health may also be related to mental health. Mental health is not just mental health. Mental health is education. Mental health is employment. Mental health is also a right to having a roof and 4 walls securely protecting you, and so forth. And so anything you can do to contribute towards any of these efforts, towards fulfilling any of these needs within the community, is itself its own kind of investment and effort towards an improved mental health landscape. And so for those of you who either are new to the area or have some experience with it, just keep building up on your knowledge, keep finding out more ways, not more ways, but just more knowledge about mental health in general. And also understand that you can become involved just by the way you talk to other people, the way you treat other people, the extent to which you take it seriously when someone says they're struggling or not. That is its own your own contribution towards making this big transformation that we are trying to achieve. Because as we've been saying, it can't be done in silos. It can't be done us alone doing it. We can't do it by us acting in solid as an individual. But at the same time, as an individual, you do have a role to play. And if we all were to make some of these small steps and make these small efforts in our own way, then hopefully it contributes to that larger change that we would like to see across society as a whole. So just keep learning, keep reading up, and keep supporting whoever is within your circle. I think do what you can to make sure your loved ones are attended to in whatever way you can. That will be your contribution to mental health. You need not join an organization like ours, though it would be great if you have time, because we're always looking for extra assistance and help with our various efforts. But if even failing that, doing any number of those smaller things could be your own contribution to the mental health landscape in Malaysia.
Thank you so much, Prash. Thank you so much for your insights today. Dr. Hazli, to you, ada apa-apa mungkin pesanan terakhir Dr. Hazli buat mereka yang mendengar, insyaAllah?
I think the whole idea about mental health is everyone's business. Yes, meaning that we can contribute. And when most of the time we didn't realize until it happened to us, right? And then we realize, oh, this is something that is really really affect us. Unfortunately, we don't want people to experience mental illness, for them to understand what the importance of maintaining good mental health. That's what we want to do. But one thing that we need to be sure also, I mean to realize, Anita, people with mental illness, people have a poor mental health. They don't want to be treated differently.
Yes.
They want to be treated equally like any other illnesses, any other poor health. They want to be treated the same as people who have cancer, who have diabetes, who have respiratory problem, who have COVID positive, because they want to be treated the same, not better. So if we able to do that, we have no problem. We have no stigma. We have no discrimination. But everyone is different. Everyone unique. So does people with mental illness. So there is no one shoes that fit all. The important for us to provide the options, and then is our responsibility also to provide the good working environment to the mental health providers themselves. Sometimes we forgot that they also human beings, they also can have mental health issues. So the volunteers in Miasa, they also need to be supported as well.
Yes.
So the whole idea, sometimes we, even the superheroes, superwoman, superman, they need their sidekick, and then they need to take a rest, to take a break. That's what we need to look after ourselves as well.
Okay. All right. Thank you so much, Dr. Hazli, for your last words. Terima kasih banyak-banyak ya. Terima kasih kepada Prash and kepada anda semua yang menonton sesi Facebook Live kita, iaitu Transforming Mental Health for All, Inspire and Inform Change. Maybe I'll just end with, everyone has a right to mental health, and everyone deserves a chance to thrive. So together, enable this situation for everyone. And again, what I always say, a society is judged by how we treat the most vulnerable, the most marginalized, and the person that has the least. So I hope together, it must be a collective effort. And those of you that are struggling, please reach out for help. Again, there's so many different, various bodies in the community, clinical practices, clinics, hospitals, those that, are passionate for the cause that can help you. So thank you so much, everyone. Thank you for your time, and thank you for listening. Take care and please stay safe. Saya sudahi dengan wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi ta'ala wabarakatuh. Thank you, everyone.
Thank you. Take care, everybody.
Thank you. Thank you, Dr. Aziz, Prash.
Thank you. Bye.
Right.
Bye, Pasad.
Take care, doctor. See you soon, hopefully.
Okay. All right. Alhamdulillah. All right. Thank you. Oh.